Okay, so then we're going to open this up, and again, like I said, we'll keep everything on a barrier because it does stain. We use a pipette because it's kind of the easiest way to get it out of there. It brings up more than you actually need, so what we're going to do is we're just going to do one little drop like that. Stick it in there. We're going to put the remaining back because everything is clean that we're using. Screw this back on so we don't spill it. And put this right back here, and then we'll just pick up our barriers and the pipette that we use. Just throw everything away like that, and then you have a clean tray.
Is that light?
I can see, yeah.
Yeah, I know.
Yeah. Good job. There we go. That's perfect, doctor.
Go ahead. Okay. You found us.
Okay, my pleasure. So we've actually just moved from Salt Lake City to Seattle, and so we're not locals, and we did search this practice out. When my daughter was about 6 months old, she'd already had quite a few teeth, and I noticed some yellowing on her teeth. I was night nursing, and she'd started solid food, and I asked her doctor at that time about the yellowing, and he said, it's nothing, don't worry about it, you're just being a nervous mom. So I didn't, and then at 12 months it looked significantly worse, and I made an appointment with a dentist, and also saw her doctor again, who still said, it's fine, don't worry about it. Later that day, saw a dentist who said she has severe decay on her 4 front teeth and she needs crowns across all 4 front teeth, and that it would be performed under either general anesthetic, or I think, is it unconscious sedation? Conscious sedation.
Yes.
And with a background, I've got a master's in molecular biology, and with a background in working in the drug development industry, I wanted to understand the drugs that were being administered, that would be administered to her, and the further I got into it, the more concerned I got. Between the Mayo Clinic epidemiological study that showed the association of, the association between people who'd had 2 general anesthetics before the age 2, and I think it was a 37% incidence of a learning disorder, and then, a lot of what seemed like hand-waving to me about, well, it doesn't show causation and so forth, and that's fine until you look at the monkey studies on 5-day-old monkeys. I can't remember if that was propofol or ketamine, but it clearly showed neuroapoptosis during synaptogenesis. Same in the rats, and I think there's reason for real concern. So I started really digging for an alternative and found the use of silver diamine fluoride in other countries, and read a paper that said there was something like an 80% success rate in rural China. And I thought, well, if they can get 80% in rural China, I think we can probably do better than that with better monitoring and things. So I pursued that. My dentist hadn't heard of it. Someone from his office at the time, the office manager actually called me one night after I canceled the procedure and told me that my daughter could die, that the infection could go systemic and she could die and there's no alternative, and did I really understand how serious this was, and that sort of thing. So it was a really traumatic experience to be faced with this choice of what I read in the literature as brain damage versus a risk of dying, and which is not a good choice. And so I was quite happy to find someone in the United States practicing the equivalent of the silver diamine treatment or something similar to it anyway, with the silver nitrate and the fluoride varnish. And we haven't done an x-ray in the last couple months, but she was still going back to that other dentist and having x-rays, and after I think it was about 4 months of treatment, there was no progression at that stage in the decay, and so they were actually quite intrigued. I haven't been back to that practice recently, but I think things are pretty stable. And